To the latest on the spread of COVID-19 here at home. There are now 14 cases in Canada, and the number of people infected globally is growing. Travelers are especially on high alert. Our Miranda Anthistle joins us now from Pearson Airport this morning with more on all of this. Good morning to you, Miranda.
Good morning, Travis. Yes, well, people here are showing some concerns, but it really seems to depend on where exactly in the world they're traveling to. Of course, there's lots of talk about the latest cases discovered here in Toronto this week. On Monday, a woman went to Sunnybrook Hospital and it was confirmed she had a presumptive positive case of COVID-19. Now, what was unique about her and her husband's case is that yesterday they confirmed her husband also tested positive, and this is the first human-to-human transmission of COVID-19 here in Toronto and here in Ontario. Now, the woman had recently traveled back from Iran, but her husband had not traveled there. So we know outside of China, Iran is experiencing one of the worst outbreaks of COVID-19, also Italy and South Korea. So globally, international travel, people are thinking, should they be going out during March break, and what should they be doing if they are going to take a plane somewhere? Now, we have spoken to passengers here this morning at Pearson, but as I mentioned, their concern really depends on which part of the world they're traveling to. Travelers we spoke to this morning were heading off to Mexico and Central America, and we asked them if the virus was altering their travel plans. Here's what they had to say.
Not personally. It doesn't seem to be one of the hot spots, and I travel all the time for work, so it's pretty much par for the course.
I think things are getting blown out of proportion by whatever forces, the media or whatever, because I mean, I'm from the U.S. I live in the greater New York area. We deal with more stuff than this. I mean, Asia, okay, China I get, but not U.S., not Canada.
Now, public health officials here in Ontario say the risk for contracting the virus remains relatively low here in Canada. In fact, in many places across the globe, that's because a lot of countries have implemented strict travel restrictions to help contain the spread of the virus.